everybody. Thanks for joining me today to talk about self-care. For successful caregiving, it's the number one rule. And many times people forget that in order to have a successful experience as a caregiver, you've got to make sure to put yourself first. So it's just like that old analogy of getting into the plane, having the oxygen mask drop in front of you. If you put that mask on the other person first and you run out of oxygen, then you're not going to be very successful at helping that person who you are traveling with. So the same thing applies as a caregiver, is that we have to understand the importance of self-care. And today we're just going to talk about some quick essentials so that either if you are a caregiver already or you are moving into this position in your life, then you'll know some of these quick tips to keep in mind. Now, easier said than done, so practice makes perfect, but keep these things in mind. So what does self-care look like? First of all, it means taking responsibility. And we are responsible for our own needs. We certainly do get a lot of our emotional needs met as a caregiver because we are developing a close relationship with someone. However, that is not why we are a caregiver, is to meet our emotional needs. And the person we are caregiving for, it's not that person that's going to meet our needs. So we need to make sure that we are taking care of ourselves, not expecting that from the person we're caregiving. Two is have some realistic expectations. If you know this person that you're caregiving for, if you know that they have a medical condition, it's really important to find out as much as you can about that person's medical condition so that you are best prepared to focus on that. Understand the process, understand the signs and symptoms, some of the challenges that may occur along that whole journey. Many people are afraid to look into and educate themselves about what the condition or the illness is that this person has, and I understand that. But if you go into caregiving without understanding and without a plan and without some knowledge, you are certainly more likely to make mistakes. So get educated, but also be careful when you get online and you do a deep dive into a diagnosis, because you can find out a lot of information online that's not necessarily accurate, nor does it help the person that you are taking care of. Three is to focus on what you can control and what you can't control. And that's really a practice that we can apply with a lot of relationships in our lives. But when we're dealing with somebody who has a compromised health condition, there's a lot of things that are out of our control. So we have to focus on our own care every day and those things that we can control in our lives. Trying to have a schedule for our own self. When we eat, what we eat, how much we sleep, when we take a break for ourselves. Also, what are the things that we need to be taking care of for the person that we're caregiving for? What are the things that are out of our control? We can't control this illness that maybe this person has, but maybe we can control our approach to it and how we respond and how we communicate. That's something in our control. Many times they lose their control because of the illness that they have. Four would be communicate effectively and clearly your needs and your concerns. So if you're telling people that you need help, please understand people cannot read your mind. They don't know what you need help with. You need to be able to say, I need help with getting mom to rehab 2 times a week at 4 o'clock. I need help with balancing her checkbook. So those are things that we need to ask for help. So the more specific that you can be, the more likely people are going to be able to respond to you, and you'll feel like you're getting the help that you are definitely in need of. 5 is learn about your emotions. What triggers you? What gets you into a place that maybe you're not being the best caregiver that you can be? Do you have people in your life that you can turn to? Can you find some resources through maybe some of the nonprofits that support the disease or the illness that maybe the person that you're caregiving for has? Look for some of those free resources, free coaching. A lot of this information is online. Get help, number 6, when you need it. So make sure that you're not trying to tackle on this whole experience all by yourself. This sometimes takes a village, right? It's not just one person that provides the care for someone. You've got to have help, you've got to have support, and you have to also understand when that is necessary. And finally, set goals and work toward them. Set goals for yourself as a caregiver. If you want to take a vacation once a week, plan it a year in advance. Make sure that you build in all those steps to make those goals possible. Same for the person you're caregiving for. Make very specific plans if you are trying to reach goals, objectives that are measurable and that you can meet. So hopefully some of these tips will help you as you move into your caregiving role. Come back for more and hope to see you soon. Thanks.